it seemed like a long process. It was a very, very complicated process, but it was really kind of interesting to see and have that. I mean, there was a lot of people that, I mean, they asked everyone from physicians down to the housekeeper. I mean, how are you going to clean this? It was just amazing to be in that group with all those people sitting at the same table. Honestly, the feedback was great. It was we could say our exact piece and our exact what we thought, as well as receive that feedback from others to try to come to great middle ground of what we need to accomplish overall. The rooms were designed around how it can affect the patient the best. And that was the goal of the whole deal, is putting the patient in the center and how do we meet that need of that patient. And I think when you look at the design of the rooms where the nurses are either in the room or right, they kind of have a workstation kind of between two rooms where they can look in, kind of a V-shaped kind of deal right there at the room. They have the patient servers where, you know, a majority of the materials the nurses will need for bandaging or linen or treatments will be right there. With the design, we've developed where the pharmacist will sit next to the physician in an area where the nurses are all going to be going around and the unit secretaries are going to be at. So that way, if there are questions that the physician has of the pharmacist to clarify medication-wise, or vice versa, if the pharmacist has got questions that needs clarified, it's real-time, immediate right there. We don't have to go down the hall or to a different area or a different floor to talk to the physician. We can do it straight face-to-face, sitting right next to them, as well as the nurses know where we're at. That seamless transmission of information will just flow readily like that. You know, pharmacy, part of our upgrade with this, with our medication system, is actually going to allow us, the nurse actually to be in the room to pull and document the meds, and they only have to leave once to go get the meds and come back. It's going to be all done at the bedside versus now where it's kind of done at the machine and then we bring it to the bedside. That's going to change. It's going to be done at the bedside, go grab it and come back. It definitely increases the patient safety and it increases the accountability on our staff, and it also increases our security. Or I like this room, or I like this door, or I like this curtain. And I mean, there was literally thousands, and it was literally that kind of detail that the team looked at of everything. I mean, I remember looking at the knob, like, why do we care about a knob? And then when they explained it, of running into it or having their hip hit it or a bed catch on it, it explained the design. I mean, I don't think like that. I do medications for a living. I don't think about doorknobs. When I was here, there was no cardiac services. There wasn't renal or nephrology services. I look at a lot of the service lines that have been developed over those 17 years and tell them, you know, we have a cath lab now. We don't fly people out anymore. We save lives versus hope we give you enough medication to get you somewhere else. If you're going to have those physicians, those specialties, you also have to have the equipment and the resources and the facility to support that. Every business, everything in town has changed. I've seen the Walmart go from Walmart to a super Walmart. I've seen it with no Home Depot or no Menards to a Menards and a Home Depot. The community evolves, and part of that evolving of the community, you have to evolve the hospital, or else we can't do what we need to do effectively for the future for our community. It's just what we need to do. So that's how I explain it.